interesting how sometimes when you work with patients, you kind of, as a clinician, it can be quite a daunting prospect because you think, oh, you know, what will they say? What will happen? And actually, in my experience, every single time we've engaged with patients, I've been absolutely overwhelmed with the support, the insights that they have given, and I think Michael Sears, who is an absolutely exceptional example of this, and he has worked tirelessly to support innovation and to share his thoughts and ideas and insights into improving the care for others, but also giving healthcare professionals an insight into what they're doing. So we're going to play a video and of a pre-recorded session, and hope you enjoy it.
Hello to everyone at Giant Health. We are so pleased today to be devoting this session to the honor of Michael J. Sears. The only words that I can use to even approach the definition of who was Michael is that he was an extraordinary human being. He would have been extraordinary in anything he had done. It so happens that his path was a bit determined by a disease that got hold of him when he was young. And I believe that he began to have operations in relation to this disease from the age of 12. We are so pleased today to be devoting this session to the honor of Michael J. Sears. The only words that I can use to even approach the definition of who was Michael is that he was an extraordinary human being. He would have been extraordinary in anything he had done. It so happens that his path was a bit determined by a disease that got hold of him when he was young. And I believe that he began to have operations in relation to this disease from the age of 12 on. Most of us met him in around the years 2011-12 through two events, one called MedX and one called Doctors 2.0 and You, that I had the pleasure of organizing. Michael led such an amazing life that we can't possibly do it justice, but we're going to try, and I will be back to say more. But for now, I want to explain to you that we have with us Justine Sears, who has kindly agreed to participate in what is not an easy moment, given that it was only 1 year ago and some months that Michael left this earth. He would have wanted this to be a joyous moment nonetheless. And I must say that it was with great joy that I was asked to do this. And the responses that I got from Justine, from Sarah Regari, please raise your hand for a moment, Sarah Regari from Sweden. We have Mette Dierberg, raise your hand, who's originally from Denmark, living in New York. And we have Melanie Perron in France, raise your hand, who is with us as well for this moment. So I'm going to start by asking each of you, I will call on Justine afterwards. So Sarah, could you tell us what you do today, how you remember Michael, and how he impacted what you do today?
Today I'm finalizing my PhD thesis in the topic of personal science for Parkinson's disease, and I live myself with Parkinson's disease. And I first met Michael in 2013, I think, at Stanford Medicine X, and over the years a few times more. And I also met him in other occasions in other places as well. And what he did has influenced my work enormously over the years. He used his own experiences with managing a life-changing condition in a positive, most positive way conceivable, and impacting both himself and the wider world. And he did it with such a positive attitude and such a smile on his face that he inspired everybody wherever he went. He was also fiercely autonomous, but also with a big heart to help others. And he was hilariously funny. And he was so clever and very polite and smart. And I think about him almost every day still, because he did so much for the world.
We will come back to your work after we go around with the presentations. So, Mette Dyrberg, remind us what you do and how Michael impacted that.
So I have a company where we reverse autoimmune disease, but I was, like Sara and Michael, a patient first, and someone who built a company around sort of the struggle that I went into. And so I met Michael first in 2012 at Stanford MedX, and had an instantaneous sort of connection because of the journeys that we were all taking at the time. And Stanford was sort of the place where we could all freely, totally be ourselves. I really second everything that Sara just said. And I think one of the funny things that came out of me meeting Michael was that we talked a lot about shit. And it always ended up being, are we talking shit or are we talking about shit? And we had a lot of fun in our correspondences around this distinction. But the reality is that due to Michael, I was very adamant going forward after that point of always talking about truth, talking about the importance, talking about the fact that it's one of the biggest stigmas that we have. And I have been at times told, please don't do it at investor meetings, please don't do it at this and this location. And I always think of Michael and I'm like, what would Michael have said to that? And he would have forged forward. And that was what he was. He was tenacious. And there was something about the combination of him having that heart and then the tenaciousness that never made it too much because it was just true.
Thank you, Mette. So now we go to Melanie, who would have met Michael at Doctors 2.0.
Yeah. Michael was a great human being, and for me, a very fierce patient advocate and a role model, an inspiration. And like all of you, I'm working on healthcare and how to better manage things for patients. And he is an inspiration because when he became a patient, he had the idea to invent Elevance Health and to help patients with his creation. And I think it's just incredible. And all the things which created Michael, it's a great inspiration for patients, caregivers, and all the healthcare systems. And I'm very happy to be there with you in this honor.
Thank you. So I'm going to just say about myself and then turn to Justine. So I met Michael in my capacity of creating Doctors 2.0 at Stanford Medicine X because he came up to me in 2011 and I was just so amazed to learn that he had traveled all the way from England to Palo Alto only some months after having been, as he would always say, the 11th bowel transplant patient in the UK. So when you think what that means from a medical and medication and risk standpoint to take this trip because it was so important for him, it was just very symbolic of how he saw life. I guess that it wasn't worth living unless you were going to do whatever you wanted to do. You weren't going to let some medical condition keep you from going to it. And despite that, he wanted more. He wanted to come to Paris to Doctors 2.0, and I said yes. We'll be delighted to have you speak. And then he spoke every year that we held the conference, and I would regularly call upon him for his insights because we were doing startup contests. I would submit to him all of the startup contestants to see if he agreed that they were worthy of being in the contest. And his advice was always excellent. And I'd like to add here that he really had a 360-degree view of our work because he'd begun in communication, having been himself a former marketer. He'd begun with a blog and social media. It was through social media that he found the surgeon in the UK by going to contact somebody in the US who told him, no, there's somebody near you who could do this. And then from there, he went on he paved the way for patients to create startups because he was one of the earliest to do that. And he even allowed himself to say, yeah, I'm going to go live in California, so many thousands of miles away to pursue this. And all this time, and I think this is common to everybody, whenever we would meet, he would say, but how are you, Denise? He was worried that maybe there was something wrong, sort of, like the traditional Jewish mother kind of guy around us. It was just always so invigorating, so inspiring to know that somebody who was facing problems 24 hours a day, because I don't think they stopped at night, was there to lift everybody else up. So now that I've possibly put Justine on the total edge of using 1 million Kleenex, I want to ask you about the joy that we all know that Michael embodied, and the joy in creating 11 Health and in working through the difficulties.
Firstly, thank you all. It's always lovely to hear everybody's sort of memories of Michael. The only thing I laughed at was, Sarah, you thinking that Michael was funny, because me and the kids really didn't think he was funny. Stupid maybe, but not funny. But so much of what you've all said so rings true about Michael. I mean, particularly Denise, when you say about Michael always worrying about others. He would always, that was just from the moment I met him when we were very young, it was always inquiring about other people. And I think part of that was because in the same way he never really wanted his Crohn's and all his sort of knock-on illnesses from Crohn's sort of define him. If he didn't speak about it and worried about other people, it sort of wasn't there. He didn't have to worry about himself. It was always easier to worry about everybody else and how they were feeling. And I think perhaps to his own detriment, actually, because as much as he would never let his illness take over his life, sometimes I think perhaps he put it on the back burner a little too much and should have perhaps worried about his health a little bit more, as much as he worried about everybody else. But obviously his story led to him setting up 11 Health, you know, the months he spent in bed, you know, not just from bowel transplant. You know, he spent months sitting in bed recuperating after many an operation. But I think particularly after bowel transplant, because it really was, he felt this was his new chance. You know, when we originally met the surgeon, it was very much like, I can give you your life back. And I think Michael always listened to that and always felt, okay, I've got this new opportunity. I've got to make the most of it. And he really did. And I think, you know, Stanford Medicine X was his first sort of foray in public. You know, he'd been on social media while sitting in his hospital room, but this was really like, this was the big move. Stanford Medicine X, all you know, patient entrepreneurs. It really, I think it sort of, it confirmed to him that he really could do this. And, you know, 11 Health was born from an idea. And I think what he loved about that was, it was love the thought of creating something from his own personal experience that he knew would help other people and make their lives easier. But then it was combined with having a company where he brought a team together. You know, he always refers to it as the 11 Health family. And, you know, it was a group of people that we all, you know, not necessarily, you know, some were patients, Some have stoma bags themselves, and some were just tech guys that had no idea what a stoma was and what we were after. But Michael had this way of bringing everyone together, and it wasn't just a job, it was a passion. Everybody in the company, they could feel Michael's passion, and it was sort of, it took them over as well. As you've all said, this smile he had, not only was his smile infectious, but his enthusiasm was infectious. And I think it was sort of a knock-on effect. You couldn't help but listen to Michael and walk away thinking, oh my gosh, yes, he's absolutely right. This is what we've got to do. And it just gave him that fight to carry on. Moving to California, in a way, was a dream from when he was a child and used to holiday in Florida and was like, I always want to live in the States. And it all came together. He got his chance of building a company, living in sunny California, which did ultimately make him feel so much better because, as we all know, a bit of sun when you're feeling lousy does make you feel better. And again, he thrived on it all. He just thrived building a company, building 11 Health team, and actually meeting so many people, in the course of his, unfortunately,
despite the challenges of travel. We saw him at HIMSS, where he maintained an exhibit stand. When I went to HIMSS in Florida a few years ago, he was alone holding down the stand. I mean, maybe somebody else was with him, but when I passed by, he was there alone. So I think that Michael would have said, enough about me, let's talk about the future. So I'm going to start with Sarah. Can you tell us more details? I know that your PhD thesis has to do with patient-oriented research, patient-centered research, and you are your prime research subject, or are there other patients in your research?
So personal science is the scientific arm of the quantified self-tracking movement. So it's a method, a framework to use your own observations to answer your own questions, often health related. So what I've done in my thesis is I have used myself as a research subject to sort of pilot the method for Parkinson's specifically. And then I have reached out to other people with Parkinson's and have them sort of made some assessments of how applicable the methods would be to them as well. So that's as far as I could do it during my PhD. So I haven't had other people using the same tracking methods, but I have talked about their feelings and experiences with tracking themselves as well.
Is there any particular learning that has come to you so far from this tracking? One thing that stands out?
That would have to be the burden of tracking, which we all know, of course, is a real thing. But how really significant that burden is when you need to track 24/7, how much it emphasizes your patient role rather than the person you want to be. So I always say that nobody wants to track 24/7. You want to track so you're as well as you can be. And then you want to live the life you want to live rather than keep tracking.
All right, thank you. So this would make a good segue into Meta, because Meta's business is a lot about tracking to identify triggers, if I am right. I could be wrong, but
no, that is correct. And obviously because we have a disease agnostic autoimmune platform, we see a lot of Crohn's patients. And so Michael and I always had a lot of conversations around, high touch coaching, right? Because I think in the early days, everybody was always talking about digital taking over. And whereas 11 Health has sort of like the high touch variables, high tech variables, in combination with coaching, that's also the premise behind what we do. We do data collection and pairs it with health coaches that have reversed their own autoimmune disease. And I'm still a firm believer that technology is what's making all of this possible, but that the heart and the human in this is really coming down to having sort of that human touch at the end of it. And in our business, it really comes down to unraveling these unknown causality spaces using technology, but then having these machine insights translated into human behavior using health coaches. And so obviously a lot of the conversations we had in the early days was passive tracking, active tracking, all of these concepts that Sarah and I have spent numerous days and nights thinking about, talking about, and we were really in the very early days of this sort of movement, right? So there was more questions than there was answers, and I think that was what intrigued all of us. It was what kept us going, and in Michael and my case, we were very aligned on what we believed needed to be done for the individual patient. And so for us, the N of one, always seeing the patient, the person first, and then lining up sort of all of the N of ones to get a concrete learning that could then be applied to the next person. And so he will forever live on due to the major contribution that him and everyone else on this call did together. And the one thing that always would stand out is he was the first person that ever said to me that the rising tide lifts all boats. And it was funny because even earlier this week, and I didn't even think about it until I'm on this call now, we have this like baton of intros and Slack. And one of the questions was, what is the best advice for the MyMe team members? And I wrote the rising tide lifts all boats, because I think a lot of times what Michael was so amazing at was making sure that if there was any small thing that he could contribute with anywhere else, that would help everyone. And I think that was what both Doctors 2.0, but certainly also the community around Medix really stood for. It was, let's all get together and see what we can do if we live together.
Thank you. That was very, very helpful and beautiful. So, Melanie, I know that your story is that in honor of someone you lost, you went in search of a way to reduce pain. Would you like to tell us more about your method, which is of great interest to me?
Yeah. I deal for chronic pain for more than 20 years now, and I tested all the therapeutics possible, drugs and non-drug therapies, but the idea of Bliss, digital therapeutics, I created was born in an hospital room, in a stereo room, because I lost my companion of leukemia. He was 32 in 2009, and I wanted to do something very concrete to try to relieve the pain and anxiety of patients during all along their journey, like bone marrow transplant, like puncture, wounds, all the cares patients receive all along their journey, and which are very painful and which are very invasive. So I had the idea of creating Bliss just after seeing Avatar in the cinema in 2009, and I was just very amazed at the film, and I decided to do something. I wanted to allow patients to escape from their disease, from their treatment, and from their hospital room, and be somewhere else. So Bliss is a medical device developed for and with patients for more than 10 years, and it was created to manage easily the pain of patients. So we use music, sounds, and images in virtual reality with a universe like fairy tale and very poetic. There is no language in Bliss, so all the patients in all over the world can use it. And we create it and assess it like a drug. So we do strong clinical trials to assess the benefits of Bliss on the pain. And we're very, very proud because our first randomized controlled trial for phase 2 and phase 3 was presented at the last ASCO Congress in June. And the conclusion of the study is the Bliss is as efficient as the standard, the Meopa gas, the Hilarious gas, during bone marrow biopsy. So this study demonstrates that we have a new option for patients, non-invasive, with non-drugs to propose to patients during their journey. And we are doing a lot of clinical studies in other subjects, in surgery, in gynecology, in tooth extraction also. And we always compare Bliss to the standard because we want to have strong proofs for patients' healthcare system. So my journey as a caregiver and a patient, and my and all the paths I went through, thanks to my companion, bring me to this beautiful care. No, not beautiful care. This beautiful.
A beautiful moment. A beautiful moment
for patients, and I'm happy to have created this with doctors, with patients, and researchers also.
Yes, and I've had great pleasure in, obviously, geographically closer base from Paris to Mayenne, in meeting up with Melanie at different professional occasions and seeing the advancement of her product that, like you, Sarah, and you, Meta, has been developed with love and care for people in the way that people think that healthcare should move ahead. As for myself, I must say that I've been doing communication promoting digital health before I met Michael and since I met Michael, but that he certainly left me with the positive of always trying your best, and that what I was doing was worth it, even though progress can be very slow for the community. Unfortunately, it is moving forward faster since the COVID epidemic began, and there's greater insight into the value of e-health. So let me ask Justine. I don't know that anybody really said something new except for the work that they're doing that you might not have known. What do you think about the activities that you've heard about? And for myself, I'll just add, there's also the website VR for Health that presents the information about virtual reality that Melanie was discussing. What do you think about all these creations?
Absolutely inspiring, and it's so great to see that there's so many people that have experienced pain and difficulty and bad health in life that are trying to help themselves as well as helping other people. I think that's what it's all about. I think in a way we live in quite a selfish world where everyone's just interested in their own well-being, and I think it's just wonderful to see that, you know, I know far from it, Michael was so not the only person, you know, you are proof of that. And I think the more people that we, you know, in a way spread the world, that actually, if you do feel there's something out there that can help a patient, that can help somebody, go for it, try it. You know, the three of you have shown it is possible. It really is possible. Don't sit back and let somebody else do something that you have the idea of.
So, what would you like to say, Sarah, as a closing word?
I'd like to say that I'm very happy to have been invited to this opportunity and to meet all of you, and remember Michael for all the things he did, but also for the things that he's left for us to take further. Now, our work is not done here. This is just starting.
Yes. Melanie.
Also, I want to thank you to be there with you, because it's very important to share the works of patient advocates and to inspire others. So I'm very happy to be with you, and I think it's just the beginning also. And we have to stay strong and to stay together to go further for the patients.
Meta.
Yeah, I think for me this is sort of a little bit two ways, right? Because I think one of the things that we as former patients are always unfortunately inserted into is that as patient advocates, we are also patients, right? And that means that through these 10 years that I have been sort of percolating in the space of patient advocacy, I've lost a lot of amazing people that I consider friends. And I think when you reached out to me, is, I'm off this week, and I said to my team, put it on the calendar, and they were like, but I thought you were off. And I said, this is not really work. And that's really how I feel about what we're doing here. There's the work part, and then it's all the friendships that we made. And to me, this is really an opportunity to honor Michael, and I cannot imagine what it feels like for you, Justine, because you lost a lot more than the rest of us. But it's an honor to be able to at least contribute in a very small way what he meant to us.
Yeah, thank you, all of you. I was honored, as I mentioned, that Professor Shafi Ahmed asked me to put this together. I was honored that you all said yes right away. I feel that when we're doing this, that the spirit of Michael is almost present here. As you recall, I wrote a posthumous conversation that I'd had with him on the blog after.
I can literally hear his voice in my head.
You can hear his voice, and yeah. And so, what would he say now? He might say, "Get back to work, all the lot of you." And we do find him funny, Justine. Even if it's true that President Obama was not considered funny by his wife and children, and that grounded him. But I can assure you that everyone else considered Michael to have that stand-up comedy talent, as well as everything else. So thank you, Michael, for giving us the opportunity to have known you.
Thank you for keeping it in your hearts, everybody. It really means a lot to me.
And thank you, Giant Health.